welcome back to Galen Pharmacy's channel. Today I'm going to talk through some of the ways we can manage and avoid the common cold and the flu. Today I'm going to talk through some of the differences between the symptoms of a common cold and a flu for you to identify which one it is that you've got, how to manage these from home, when it is that you may need to go and see a healthcare professional, and how to avoid it. So both the common cold and the flu can be treated at home. There's no need to really go see your GP for either of these. They can't offer you antibiotics as they're both caused by viruses. So the antibiotics would have no effect on them. But there are some cases where people get the flu and they get it quite seriously. But not to worry, I will talk you through when it is that you may need to go see your GP or even call 999 if necessary. So, there are many similarities between the symptoms that you will experience with the common cold and the flu. The main differences between the common cold and the flu is that the common cold really just affects your nose and throat, whereas the flu will affect your whole body. The common cold can appear quite gradually, whereas the flu has quite a quick onset, and so you'll start to get symptoms within a few hours. So for both the common cold and the flu, you may experience blocked or runny noses, sore throats, headaches, coughs, muscle aches. You might get pressure in your sinuses, you might have a raised temperature, and there may be some loss of smell and taste. But the differences from the common cold to the flu is that the flu can also cause tummy aches, diarrhea, vomiting, things that are more than just the nose and throat. How can you treat these at home? It's really quite simple. You need rest. You need to sleep, keep yourself warm and stay hydrated because dehydration can make your symptoms worse. There are also other things you can do at home to help your symptoms, such as if you've got a sore throat, you can gargle with salt water. But mainly I'd just say keep yourself hydrated, drinking plenty of fluids. Now this can be drinking water, squash, hot drinks such as herbal teas. Try and avoid caffeine containing products, but herbal teas are good, lemon and honey water. Often warm drinks can help soothe the throat as well. So some of the products a pharmacist can offer you to help some of your symptoms would be things like paracetamol or ibuprofen. Both of these can help to lower a raised temperature and to help with muscle aches and pains or headaches. Now, there are a lot of cold and flu products that have got some other ingredients in, and they're really good. Some contain decongestants, which will help to clear blocked noses. They can also help relieve some of the pressure from headaches, and some of them do contain caffeine. Now, if you were to take a cold and flu remedy that had all three of these ingredients in, that's completely fine and good to use when you're ill, but you just need to be careful that if you are taking paracetamol, not to be taking any other product that's containing paracetamol, as it's very easy to go over the daily limit. And just to recap, for paracetamol, if you're taking 500 milligram tablets or capsules, you should only be taking 2 tablets every 4 to 6 hours and be taking no more than 8 tablets in any 24-hour period. That's really important to stick to. As I mentioned previously, you can get decongestants as well from your pharmacist. These can help clear blocked noses if you're really struggling to breathe or it's affecting your sleep. And these can either come in tablets or you can get nasal sprays. But I would recommend visiting your pharmacist to see what is best for you, and they will also advise you on how to use these products. A lot of you may be wondering about whether it's useful to be taking vitamin C tablets or multivitamin tablets. Now, it's always good to maintain a healthy lifestyle, and if you are eating a varied diet, you should be getting a lot of these vitamins and minerals within your diet. So you shouldn't need to be taking extra supplements. There is also very little evidence that vitamin C or even garlic will prevent you catching a cold or boost your immune system to help you get over it quicker. So they wouldn't cause you any harm, but if you have a healthy and varied diets, there is no need for these products. So when to see your GP? Well, you want to go and see your GP if your symptoms haven't improved within 3 weeks, or if you're feeling particularly hot or shivery and you've got a very raised temperature. These are all signs to go and see your GP. And if you have any long-term medical conditions, such as diabetes or heart, lung or kidney conditions. But I suspect if you do, you will have discussed this with a healthcare professional in the past and you should know what to do in that situation. In some cases, it may be necessary to call 999. This will be a very rare event, but it's worth you knowing what to look out for in case this happens to you. So when to call 999 would be if you experience sudden chest pains, if you're having difficulty breathing, or if you're coughing up blood. How to avoid spreading the cold or flu. Cold and flu are spread by germs from coughs and sneezes, and these can live on hands or surfaces for up to 24 hours. Both cold and flu are caused by viruses and are quite easily spread to other people. With cold, you're infectious until all of your symptoms have completely cleared, and this usually takes around 1 to 2 weeks. Whereas with the flu, you're more likely to give it to somebody within the first 5 days. To reduce the risk of spreading cold and flu, you need to make sure you're washing your hands regularly with soap and water. The good old phrase of catch it, bin it, kill it. If you are sneezing, make sure you've got tissues with you. Making sure you're disposing of those tissues immediately and thoroughly washing your hands afterwards. Don't share towels or household items with other people in your house that aren't infected. This can help to control the spread. And ways to avoid catching the cold and flu. These can be washing your hands regularly as well, especially before eating. Avoid touching your nose or mouth if you've been in a public area and your hands aren't clean, because you could have come into contact with the virus. And really, as I said previously, it's staying fit and having a healthy diet. For the flu, there is an annual flu vaccine. It is a safe and effective vaccine that's offered from most pharmacies. It can help you to prevent yourself from getting the flu and also protect those at risk. And I think from the COVID-19 pandemic, I think we can all appreciate that vaccination is really important to control the spread of viruses, to protect you and others. More information on the cold and flu can be found at the NHS website or visit your pharmacist today. Thank you for watching this video. If you've got any other comments or questions, please leave them in the comment section and don't forget to like. Thank you from all of us at Galen.